Well, those 80 plus in different regions are already registering and going online to get their vaccinations. Those here in Toronto are going to have to wait a little longer. Officials aren't exactly ready to roll out the red carpet just yet. Today, it was all about telling everybody about a brand new playbook to roll out the vaccines, and that includes adding more people to the first group to get them. You name it, and Toronto officials say the city has or will eventually have it covered when it comes to vaccines.
This will be the largest vaccination effort in the history of the City of Toronto, and I am very confident we will be able to meet this challenge.
More details on how to get shots in arms were offered up today as part of a 52-page playbook City Hall has come up with. Included are the 9 mass vaccination sites being set up and apparently 1,400 staff being trained, but also 49 hospital-operated clinics, 46 community health centers, and 249 pharmacies that will distribute vaccines.
We're bringing on board 280 neighborhood ambassadors to promote vaccines in their community. Your local priest or your pastor or your rabbi or your imam, your barber, your crossing guard, the kids' soccer coach.
Who is considered the first priority for taking advantage of the plan and getting vaccinated is still being questioned, though. Those 80 years and older were added to the province's Phase 1 rollout plan, but Toronto says there are 100,000 healthcare workers and others in a virtual line first.
Our population of people 80 years of age and older is roughly equivalent to the population of the entire city of Guelph.
At the same time, Toronto announced over the weekend that the city's homeless were going to be among the first to receive their shot as well.
Well, it's the moral argument and it's the research argument that shows that basically if we don't vaccinate this population soon or prioritize them, they will die. This change in policy will ultimately save lives.
140 community agencies will also be included to promote vaccines and help identify locations for mobile and pop-up clinics. But, as has been the case, the official fallback is that it still depends on when vaccines become available.
The more free-flowing vaccine supply comes, the easier it becomes for us to really start addressing needs across the broad range of populations.
Now, unlike some other regions, Toronto said it will not be setting up its own system to book your registration for vaccines. Instead, they'll be using the province's system to make sure that they can gather more information on a larger scale.